Are my heart palpitations a heart attack? I'm tired all the time. What are the symptoms of MS? Tingling skin. What does this mean?
They are the desperate searches of someone who is sick with worry.
You're checking how you're feeling, how you're thinking. Is your heart racing too much? Is your skin feeling tingly? Does that mole look normal?
It is what's known as health anxiety, when the fear of being ill takes over your life, leading sufferers like Vicky to spiral.
I was going to the doctor probably 3 to 4 times a week. I wasn't sleeping barely at night. I was like a shell of a person. You do know deep down that you're being over anxious, but there's always this tiny little bit in your brain that's going, no, like if you ignore this, it could be X, Y, Z. You must go see your doctor.
Exclusive polling for this programme shows Vicky is far from alone. 2/3 of Brits experience health-related anxiety. Over a quarter have booked a GP appointment after looking up their symptoms using AI. And almost a third feel that doing that makes them feel more anxious. There is nothing new about health anxiety, but it has become more acute in the digital age because now a simple search of often harmless symptoms online can leave sufferers feeling more worried than ever. So much so that it has now been coined cyberchondria.
It's Dr. Khan from the Ridge Medical Practice.
Something Dr. Amir Khan sees at least 10 times a week.
My worry with AI is that it is not designed to reassure. It is not designed to weigh up the nuances that are needed in a consultation. So I don't have that much of an issue of people coming in with symptoms that they don't need to see me for. The problem is then it means other people can't see me.
It is estimated that unneeded care costs the health service more than £400 million a year.
If you in fact could solve the problem and treat the health anxiety, you wouldn't need that cost at all.
There is a treatment which can help though, a type of cognitive behavioural therapy. Experts say frontline medical staff need to be trained in it.
We've almost got the NHS to adopt a training programme, but they haven't quite got there yet. We can have treatments available so that the people who come up repeatedly with health anxiety can actually have an intervention which is relatively short, only about 6 sessions, and once we've given that treatment it tends to last. It's like riding a bicycle. They can pick it up and they can learn it again if they get their symptoms back at some time in the future.
We put this to NICE, the body which advises the NHS in England. They told us they are reviewing health anxiety and considering new guidance. The government, meanwhile, said it is investing in thousands of mental health workers and expanding NHS talking therapies.
When I was at my absolute worst.
After years of treatment, Vicky has now overcome her anxiety.
I'm lucky that I got the help that I needed, and I really, really sympathise with people that are going through it.
For them, the many still at war with their worries, that help is badly needed. Philip Syme, ITV News.